into 17th match of Cardiometabolic Premier League, the Battle of Brains presented by PSIM and PHL, powered by Wilson's Pharmaceutical. We are into the 17th match that is between AMC Troopers and CMC Lions Ladkana. It is in fact second match of Group F, and we all know the format of the match. It's again a knockout match, and only one top team from each group will move to Super 6 stage. For umpiring purpose, today we are blessed with the kind presence of Professor 𝐏𝐚𝐤𝐬𝐿 Sahab. He is Professor of Medicine and Senior Vice President of PSIM. He would be serving as an umpire of today's match. And for moderation purpose, we have with us Assistant Professor 𝐏𝐚𝐤𝐬𝐿 Sahab. He is Assistant Professor of Cardiology and Stroke Interventionist. For further moderation, over to Dr. 𝐏𝐚𝐤𝐬𝐿 Sahab.
So thank you very much, Usman. Yes, we are back again. And I'd like to take this opportunity to welcome you all to this amazing first season of Cardiometabolic Premier League. And we all know that it's now the group stage which is ending, almost coming towards the end. This is the second last match, an extremely important game. And it is going to be played between two teams. One is AMC Ayub Medical College Troopers, and they are going to be up against CMC Chanaka Medical College Lions, straight from Larkana. And I think it is going to be two provinces which are going to be up against each other. So I welcome you all once again, and we must not forget that this wonderful show has been put up by Wilson's Pharmaceutical in collaboration with Pakistan Society of Internal Medicine. As we move on, I'm going to move towards the dignitaries. And definitely, first of all, we do have our umpire. He's the life of the show. He's the one who keeps everything held together in the balance. And it's none other than Professor 𝐴𝐵𝐬𝐻𝐿 Sahab. Welcome, sir. It's great to have you.
Thank you.
And I think we'll have, as we have more people coming in, the panel, we will have the introductions as we move on. So I do believe the two teams, they are there. And I've just been told that Professor Hakim Abro Sahab, he's also there. He's the mentor of CMC Lions. So, sir, welcome aboard. Your team is ready, and best of luck to all of you. So I'd like to move towards the two teams now. And I'll ask their captains one by one to give the introductions of the teams. So can we have CMC Lions on the screen, please? Okay, wonderful. So, Captain, start with the introduction, please.
I am Dr. Noor Hussain, R4 resident at Medical Unit 1 CMC Hospital, Ladkana.
Okay, and the introduction of your team, the team players that you have with you.
This is Dr. Noshin. She is also postgraduate resident here in Medical Unit 1. And here is Dr. Almas. She is also postgraduate resident. And here is Dr. Nadia. She is also a postgraduate resident.
So really excited to see, girl power there with you. Best of luck to you. Are you ready for the game?
Yes, sir.
Okay, all right. Good luck. So can we have AMC Troopers now on the screen, please?
Assalamu alaikum. I am Dr. Muhammad Bilal, captain of AMC Troopers, resident internal medicine Ayub Teaching Hospital, Ahmedabad. Alongside me, my colleagues are Dr. Adil, Dr. Maz, and Dr. Awais Waqar.
All right. So, are you confident today?
Yes, sure.
All
yes,
right.
sir,
That's what we need. We need the teams to be confident. They have to fight it out, and the game has to be played in good spirit. So, sportsman spirit is the key. Very well done. Best of luck to both the teams. And as you know, the things have been quite overcast. We've had a lot of rain, and we know the outfield gets a bit damp. Now, the pitch, it can be tricky, but let's see what happens today. We've had some very good high-scoring games, then some average games with average scores, but then the fighting spirit has always been there. So with this, I think I now move towards the next stage, and that is going to be the electronic coin toss. So can we have it on the screen, please? So I'm going to randomly ask one of the teams, and rest is your luck. So can we have AMC Troopers on the screen, please? You want heads or you want tails? I couldn't hear you.
Heads.
Okay, so they've called heads. So roll the coin. And it's a heads. All right, the luck seems to be going with you. I can see some smiles, but never mind. You know, there is still a lot to be done, a lot to play for. So I'm going to put you and pose you with two questions. The first one is, do you want to take the questions or you want to throw the questions?
Okay, sir.
What do you want?
We want to take the question.
Okay, you want to take the questions. All right, now the second question. So it's again your luck. You want case A, scenario A, or you want to choose case B?
Sir, case B.
All right, so they've chosen case B, and the news from the center is AMC troopers, they won the toss. They want to take the questions and they've chosen case B. So, sir, Professor Aziz Saab, do we have the permission to start the game?
Please go ahead.
All right, so we have the go-aheads and I think all the blessings that we need. So let's start the game. Can we have the first scenario on the screen, please? And I will request CMC Lions to read the scenario and then the question when they're given the nod. Read the question, please, CMC Lions. Okay, the scenario is there, CMC Lions. You have to read it. Okay, I think we can't hear CMC Lions. Can you hear me there?
Yes, sir.
Okay, so you will have to unmute yourself and speak louder, please, so that we can hear you.
Yes, sir.
Okay, read the question.
63-year-old male farmer smoker with history of hypertension, dyslipidemia, and coronary artery disease, present with poorly controlled blood pressure of BP of 174 by 98 millimeter of mercury, despite taking optimum doses of amlodipine, hydrochlorothiazide, and atinola. He reports occasional dizziness, muscle cramps, and episodes of rising serum creatinine. Recent labs show serum creatinine of 2 mg per deciliter, estimated glomerular filtration rate of 38 ml per minute per 1.73 meter square, and potassium of 3.2 millimole per liter. On examination, a systolic bruit is heard over the upper abdomen. Renal ultrasound shows asymmetric kidney size. CT angiography reveals 70% stenosis of right renal artery.
All right, so I'm going to give the troopers a couple of seconds to gather yourselves. Please let us know when you're ready for the first question. All right, so are you ready?
Yes.
Yes, sir.
Troopers are ready, and I'm going to request the team which is reading to keep the mics unmuted, and answering team to keep the mics unmuted, whereas everybody else should be muted so that we can hear everyone without any echoes. All right, so bring the first question on the screen. CMC, read it. Read the question, Lions.
What is most likely diagnosis? Essential hypertension. A. B. Hypertensive nephrosclerosis. C. Renovascular hypertension. D. Cohn syndrome. E. Pheochromocytoma.
And the timer starts now. You've got 60 seconds to answer the question, AMC troopers. And please unmute yourself, AMC troopers. We want to hear your discussion, whereas the other teams to be muted.
Sir, our option is option C, renovascular hypertension.
Okay, you still have time. You want to come down the wicket and hit it for a 6? Are you sure?
Yes, we are sure, sir.
So I do see a bit of Shahid Afridi in him. Which is the correct answer? Which one? Which one should I lock?
Option C, sir, C.
Okay, he wants me to lock C Charlie. Renovascular hypertension. Lock C Charlie. And yes, what a start. So Afridi is booming. Well done. Wonderful start. That's exactly the kind of start we always need and look forward to. Very well played. All right, moving to the second question. On your screen. Read the question, please. Lions, read the question, please. Lions, you are supposed to read the question.
Which of the following is most likely underlying cause in these patients? A. Fibromuscular dysplasia. B. Atherosclerotic renal artery stenosis. C. Tachycardia arteritis. D. Thromboembolic renal infarction. E. Polycystic kidney disease.
And the timer starts now, 60 seconds. Okay, I would like the answering team to be on the screen and please keep yourselves unmuted. Whereas CMC, once you read the question, you're supposed to mute yourself. Thank you.
Sir, option B.
Okay, option D, delta.
B नहीं sir, B Bilal, B.
B, okay, B, Bilal, B, beta. Very good. So let's see. And they want me to lock B, beta. Lock B, beta, please. Oh, yes. I think this one he got as a full toss and I think slammed it through the long on for a 6. Very well done. So 2 in a row. Let's see what happens on the third one. Question number 3 on your screen.
Which finding best support the diagnosis of renovascular hypertension? A. Hyperkalemia. B. Bilateral shrunken kidneys. C. Proteinuria. D. Asymmetric kidney size and imaging. E. None of the above.
And your timer starts now, 60 seconds on your screen.
Delta, हाँ इसमें सबर डिस्कस होकर डेल्टा इसमें केस में सही सेलेक्ट किया केस सही सेलेक्ट किया सर डी डेल्टा.
If you please hold on, there's an intervention. I think, is that the question correctly marked there? In the notes I've got, I think the correct answer is E, but actually it is D. D should be considered.
Sir, yes, we have answered D, delta.
Yes, that's right. D should be considered the correct answer.
Yes, sir.
Okay, so they did go for D. So you said D delta, right?
Yeah. But in the notes I've got it's marked E, but actually I think correct answer is D.
And that's very right. So I think Z Saab, right, coming at the right time. He's coming in with his input, and that's why he becomes so important. So the correct answer is D, and you did answer D. So very well done. I think again I do see a lot of flair, and this Afridi is not stopping at the moment. I think the other team needs to find a Jayasuriya the way he's going. So 3 6s in a row. Very well done. Very well done indeed. Okay.
अजीज साहब
जी
मुझे थोड़ा सा इस पे ऑब्जेक्शन है इस सिस्टम पे जो चल रहा है ना, तो इस पे तो कोई दूसरे को चांस ही नहीं मिलेगा ना करने का. अच्छा नेक्स्ट बार कुछ काम कर दो. ओके सॉरी समझ आ गया सर.
Right, sir. So all sorted. You are clear on that account. Okay, that's wonderful. So we are, back in, and I would request all of you to again gather yourselves, and we try to keep everything as fair as possible. We have the umpire in place, and if you have any queries, you can always let us know. And we also have a panel of reviewers to look into the matters. All right. So are we ready for question number 4? Read it, please.
Yes. What is most appropriate initial diagnostic test to confirm renovascular hypertension? A. Serum renal level. B. Renal biopsy. C. CT angiography of renal arteries. And D. Iodine cystourethrogram. E. MIBG scan.
And your 60 seconds are on your screen.
Initial CT confirmatory.
Most appropriate. लेकिन तो कंफर्म नहीं करता वो कौन सा ड्रम करेगा इसी एंजियोग्राम पे जाते हैं।
So there is some discussion going on. Yes, carry on. You've got 25 seconds.
सी पे जाऊँ इनिशियल ए
Approaching 15 seconds now.
सर ऑप्शन सी
Are you sure? Option C. You want me to lock it? C, Charlie.
यस सर
Okay, so there is some discussion that was going on, and we are going to lock C, Charlie. Let's see. And yes, that one came in onto his pads, flicked for a 6. Very well done, very well played. So they did discuss it and they had a consensus. So well done, very well played indeed. So 4 6s in a row, that's great going. We are going to move ahead to question number 5.
which medication should be used
Read the question, please.
Which medication should be used with caution in people with bilateral renal artery stenosis? A. Amlodipine, B. Beta blockers, C. ACE inhibitors, D. Thiazide diuretics, E. Alpha blockers.
And the timer is on your screen now.
सर ऑप्शन सी AC inhibitor
Okay, the Afridi actually came down the moment it was delivered. Are you sure? You want me to lock it? Should I lock it?
yes sir locked it option C
Option E or C? C, Charlie?
C sir C Charlie
Okay, so lock C,
G,
Charlie. Lock it, please. And yes, that was, he came down like a flash and down it went and high it went for a 6. Very well done. Great going so far. So we are in for another hat trick. 2 consecutive hat tricks. Will take you to 36 in 6 questions. Very well done. Question number 6 on your screen.
Screen is blurred, sir. We are not seeing it.
Okay, technical team, can you help them out?
What is mechanism by which renal artery stenosis leads to hypertension? A. Increased aldosterone production directly by the kidneys. B. Activation of sympathetic nervous system. C. Increased renal release due to renal hypoperfusion. D. Volume deposition causing vasoconstriction. E. Inhibition of nitric oxide synthase.
Timer starts now, 60 seconds.
डिस्कस करो ना सी और ए में करो सी की
सबर करो एक मिनट
पढ़ना सिंपैथेटिक नहीं है यार रीनल आर्टरी स्टेनोसिस में रेनल से हो जाता है रेनल ज्यादा होता है सी है यार सी ठीक है हाँ रेनल ज़्यादा हो जाते हैं चार्ली सी ठीक है ना सर ऑप्शन सी चार्ली
Are you sure about it?
यस सर
So they seem to be very sure. Now, is this a dusra? Let's see. Okay, lock C, Charlie. And yes, wonderful. So that's 2 consecutive hat tricks by you, and they've taken you to a score of 36 by answering 6 correct answers. Very well done. I think we are in for a big total indeed. But at the same time, I would also like to encourage the Lions. Don't lose hope, because when your turn comes, you can come up with the same goods, and believe you me, only one question can make all the difference. So keep your spirits high. Can we have question number 7 on the screen? Read the question.
Which of the following is major clinical clue that suggests fibromuscular dysplasia rather than atherosclerotic disease? Male sex, age more than 60, unilateral disease, female less than 40 years with resistant hypertension, E. coexisting coronary artery disease.
Timer is on, 60 seconds.
सर ऑप्शन डी डेल्टा
Oh goodness, again, he's onto it like a flash. So, Afridi, are you looking for a century or what? Okay.
Yes, we are trying, sir.
Okay. So, which one?
Delta.
Which option? Delta. D delta. You're sure? D delta?
Yes. Yes, sir.
He's very sure D delta, and he's played the Afridi scoop, and I can see it going over the mid wicket side. Let's see what happens. D delta, lock it. And yes! That makes 7 in a row. Well done. Superb. That's great going. We are definitely looking at a good score indeed. Maybe we may just get 10 on 10. All right. Lions, you have to play like lions. And I see lionesses with you, lion, in the center. Read the next question, question number 8.
What is the best management option for this patient at this stage with a significant atherosclerotic renal artery stenosis and resistant hypertension? A. Immediate surgical bypass by renal artery. B. Percutaneous transluminal renal angioplasty with stenting. C. Bilateral nephrectomy. D. Renal denervation. E. Watchful waiting with intensified medical therapy.
Stenting therapy.
All right. Timer starts now.
मैंने बाईपास में स्टेंट रखते हैं इसमें उसमें मेरे साथ जो हमारा पेशेंट उसको सर ऑप्शन बी बीटा.
Are you sure? B beta. You're sure about it?
Yes, sir.
He's got a reference patient as well. I think he has dealt with this case. That's interesting. All right. You want me to lock B beta? Okay.
Yes, sir. Lock it.
Lock B beta. He's very confident. Lock it. And rightly so. Very well done. That's a straight 6 over the boundaries, over the ropes. I know. Now everybody is excited. We do see a big score. Well done. Well played. It's 48 already in 8 questions. 100% score so far. 2 more to go. Second last question on your screen.
Which of the following is not typically associated with the renovascular hypertension? A. Flash pulmonary edema. B. Sudden onset hypertension in the elderly. Rapid decline in renal function with ACE inhibitors. D. Hypokalemia. E. Hypercalcemia.
Okay, timer starts now. 60 seconds.
इसमें हाइपो होता है हाइपर नहीं होता हाइपोकलीमिया होता है हाइपर नहीं होता ई में क्या ऑप्शन है हाइपो ना डी में डी क्या लिखा है हाइपो तो होता है
हाइपो तो कंफर्म होता है ना डिस्टिरोन करता है
सडन ऑनसेट हाइपरटेंशन तो नहीं होती हाइपर
25 seconds to go. The spinner has flighted the ball well. Let's see. Come on, 15 seconds.
सर बी बीटा.
Are you sure about that? You want me to lock
Yes, sir.
B? Beta.
यस सर बी जी सर.
Okay, they are saying lock B beta. Lock it. Oh, that's the first miss. My goodness. And I could see the googly coming in, and you were playing for the outside ball. The ball that moves away from you. Okay, never mind. That's the first blemish. But that's all right. Well played so far. We still have the last question. Question number 10 on your screen, please.
Which of the following best define hypertension? Failure of 2 antihypertensive medications, hypertension with ocular edema, hypertension uncontrolled despite more than 3 medications, including a diuretic, hypokalemia, hypertension with end organ damage.
Okay, the timer starts now. 60 seconds. The technical team, do look into this matter. I think the signal was dropping in Larkana.
C Charlie.
Oh, again, Afridi, you want me to lock it?
Yes sir.
See, Charlie, you're playing a Dill scoop. Let's see what happens. Okay, if that's what you want, lock C, Charlie. And yes, the Dill scoop has gone for a 6. Very well done. Very well played. I think it's a wonderful performance. And now we come to the end of this innings. This is the first innings, and AMC Troopers, they have really put up an extremely competitive score. And they have given 9 correct answers out of 10, just 1 miss, and which gives us a score of 54. Very well done indeed. And with this, I'm going to move towards our umpire of the day, and he is there to guide us as always. Sir, Professor Azeezur Rahman Saab.
Very interesting, confident batting. And unfortunately, they dropped one. I think probably didn't think it well. I think that was also possible. But this is the match. But really very, very good play.
Very right, sir. I think that question, when you look at it, I think the wrong answer was popping out from the outset. So,
Yeah.
but then again, when you get overconfident at times, you can miss
And
things.
I think in one of the questions, I'm not sure, they said, I heard D, but you said, is it C? And they said, yes, C. Maybe you led to the correct answer. I'm not sure.
Okay, can we...
I'm not sure, but since they said before the time closed, they said C, so it should be...
I think because, I remember. So I think it was C Charlie. So they corrected me with that.
I heard that they said initially D. Let's ask them. Let's ask them honestly.
Can we have them on the screen, please?
Yes, sir.
Okay, you remember that
Was your
instance?
initial answer D or C?
Charlie bola tha, sir, Charlie.
Charlie, yes.
Okay.
So mostly that's what we do. So yes, and we always try to correlate it with the phonics, so that we know that if we are hearing incorrectly, that's why we always promote the use of these.
No, they did say Charlie. Once you ask, is it D or C? To my impression, initially they said D, but on your suggestion, they corrected themselves.
Yeah, there's a possibility. Maybe they thought.
This is my impression, but within that allocated time, they answered C, so they should be counted as correct answer.
Yes, sir. I think maybe your observation may be correct, because at times they can also try to second guess. So I don't know if they were second guessing, but we never try to give any idea to anyone, or we are never trying to lead you, but if we keep it as open, as fair as possible. So yeah, I think the observation may be there, and that's why I try to recheck multiple times, so that we are trying to cover all the bases. But having said all that, we still think it's a good score. It's a very good score. But I also have I think a few words for the next team, which is going to be coming up and facing the deliveries, which is our team, the Lions, as we have them on the screen. So how are your spirits? Are you in good spirits, Larkana?
Yes, sir.
So you think you'll be able to beat the score?
Inshallah.
Inshallah. So that's the spirit, and I am hoping that we are going to have a wonderful game by the end of it, because that's what we want. That's what we are here for. So we are here for all of you. So let's just move on to the second half of this match. All right. So can we have the next scenario on the screen, please? All right. And I'm going to request AMC Troopers to read the scenario, please.
A 58-year-old man with 10-year history of type 2 diabetes and hypertension present progressive fatigue.
You need to go back to the scenario.
Please back to the scenario.
I think you need to go back to the scenario. They haven't yet read it.
Okay. Again, a 58-year-old male with 10-year history of type 2 diabetes and hypertension present with progressive fatigue, bilateral leg swelling, and occasional headache. BP 162 by 94. Labs reveal serum creatinine of 2.2 mg per deciliter, EFR 38 ml per minute, urine albumin creatinine ratio 700 milligram and potassium 5.2 milliequivalent per liter. HbA1c1 fundoscopy show marked arteriolar thickening, silver wiring, and arteriovenous leaking. ECG show is 220 and right ventricular 32 mm. He is currently taking amlodipine 5 mg, metformin 2 gram, and atorvastatin 20 mg daily.
Okay, so I'm going to give you a couple of seconds to gather yourself. Lions, let me know when you are ready. All right? Okay, Lions, are we ready?
Yes, sir.
Okay, bring the first question on the screen. Read the question, please. Troopers.
What is the most likely cause of this patient kidney dysfunction?
Read all the options. Read all the options. All the options, please.
A. Acute necrosis. B. Diabetic nephropathy. C. Renovascular hypertension. D. Hypertensive nephrosclerosis. E. Obstructive uropathy.
And your timer starts now, 60 seconds. Come on, Lions.
Next one. D depth, sir.
Which option? I couldn't hear you properly.
D depth.
D delta.
G, sir. D delta.
Okay, D delta. They want me to lock D delta. Lock it, please. Oh, yes. Wonderful start. That's what we want. So you need to be well thought out. Take your time. You've got 60 seconds and discuss it amongst yourselves. That's a wonderful start. Great going. That's exactly what we wanted. So we are on course. Well done. Can we have question number 2?
Which of the following antihypertensive agent is most appropriate to aid for pressure control and renal protection? A. Hydrochlorothiazides. B. Labetalol. C. Enalapril. D. Clonidine. E. Minoxidil.
60 seconds on your screen.
C, sir.
Okay. So are you sure about it?
Yes, sir.
C Charlie, right?
Yes, sir.
Okay. So this time I see a bit of Babar Azam in him. He wants me to lock C Charlie. I hope he plays like him. Lock C
Yes,
Charlie. Oh yes. Beautifully played. Straight driven for a 4. In fact, for a 6. Wonderful stroke. Very well done. Very well done. Great going. So we are in for a hat trick of 6s. Let's see what happens. Question number 3 on your screen now.
What is the target blood pressure for this patient according to KDIGO and ACA guideline in CKD with albuminuria? Option A, less than 140 by 90. Option B, less than 135 by 85. Option C, less than 130 by 80. Option D, less than 125 by 75. And option E, less than 120 by 70.
And the timer starts now.
B book.
Which one?
B beta.
B beta. Are you sure B beta? You want me to lock
Yes,
it?
sir. Yes, sir.
Okay, they seem to be pretty sure. They want me to lock B beta. Oh! That's the first miss. It was a hat-trick question for them. Oh goodness, now they're left with no margins for error. And they can draw it and then we can move ahead. All right, never mind. So the new guidelines, it's less than 130 by 80 and I was hoping for it. All right. Good. So we are still on course. Still a lot to fight for. Question number 4 on your screen.
Which of the following is most likely to slow progression of kidney disease in this patient? Option A, tight glycemic control. Option B, vasodilator beta blocker. Option C, dual blockade of renin-angiotensin system. D, SGLT2 inhibitor. And option E, non-dihydropyridine calcium channel blocker.
And your timer starts now. "25 seconds.
A, sir.
You want me to lock A alpha? Tight glycemic control?
Yes, sir.
Okay, then lock A alpha. Oh my God. That is the second blemish, which was definitely not required at this time. Okay. So never mind. We still have to play. Although we may be knowing the outcome, but this can matter because it's the scores which matter in the end, along with the outcome of the game, which is obviously extremely important. All right, let's move to the next question. Question number 5.
Which of the following is the most sensitive test to evaluate the extent of kidney damage? Option A, renal ultrasound. Option B, urine dipstick. Option C, serum cystatin C. Option D, urine protein to creatinine ratio. Option E, 24-hour urine collection.
Okay, E is 24-hour urine calcium. So 60 seconds on your screen, please. Come on, Lions. You can still do it. You can put up a good score.
C, sir.
C, Charlie. Are you sure? C, Charlie. Should I lock C, Charlie?
Yes, sir.
Okay, they want me to lock C, Charlie. Lock it. Oh my God. That's another blemish. Okay, now I think we are approaching a hat-trick of wrong answers. Come on. You have still a lot to play for. You've got a lot to play for. It's your pride. Come on, Lions. We are backing you up. Question number 6 on your screen.
What is the most likely mechanism of hyperkalemia in patient with CKD? Option A, rhabdomyolysis. Option B, reduced distal sodium delivery. Option C, hyperaldosteronism. Option D, increased dietary potassium. Option E, metabolic alkalosis.
And your timer starts now.
B beta, sir.
B beta. You sure about it?
Yes, sir.
Babar Azam, are you confident this time?
Yes, sir. Yes,
Okay,
sir.
he
100%.
says lock B beta. Lock it. And this one he has played like Babar through the covers for a beautiful 6. Well done. That's the spirit. Great going. Great going. Very well done indeed. So, we do have another score, another 6, and we are now moving to question number 7.
Which lifestyle changes has the greatest impact on reducing BP and slowing the progression of CKD? Option A, low carbohydrate diet. Option B, potassium rich diet. Option C, Mediterranean diet. Option D, sodium restriction to less than 2 gram per day. Option E, increase water intake.
You switch the timer on.
D duct, sir. D duct.
D delta.
D delta. G, sir. D delta.
Okay, he wants me to lock D delta, and this time Babar Azam has now suddenly become Adam Gilchrist. All right, D delta. Lock D delta.
Yes, sir.
And the Gilchrist has made it brilliantly well. It's a 6. Beautiful stroke. He's pulled it for a 6. Well done. Very well done. Where was the Gilchrist hiding in you? Come on.
Question number 8. Which of the following should be avoided due to risk of worsening renal function in this patient? Option A, SGLT2 inhibitor. Option B, COX-2 selective NSAID. Option C, statin. Option D, calcium channel blocker. Option E, insulin.
And the timer is on your screen. 60 seconds.
B book, sir.
Which one?
B beta.
B beta. Are you sure about it?
100%.
He says, I'm Adam Gilchrist. It's going for a 6. Lock B beta. Lock it, please. And yes, he's right. He has smashed it over the bowler's head for a 6. Beautifully played. Very well done. So wonderful, wonderful stroke play. Great going. Lions, you're doing great. All right. So the second last question, question number 9 on your screen.
Which complication is he likely to develop if this CKD worsens? Option A, secondary hyperparathyroidism. Option B, hypercalcemia and bone sclerosis. Option C, polycythemia. Option D, hemorrhage stroke. Option E, hyperaldosteronism.
And the timer starts now.
A, sir. A alpha.
A alpha. Are you sure about it?
Yes, sir.
So this time Gilchrist was supported by the team and the girl power. It says A alpha. Lock A alpha. And the girl power is right. Well done. Very well played by all of you. Well done. That's the spirit. Very well done. Great answer. So with this, we now move to the last question of this innings and this match. Can we have it on the screen?
How is left ventricular hypertrophy related to CKD and hypertension? Option A, prolonged hyperglycemia. Option B, anemia due to erythropoietin deficiency. Option C, volume and pressure overload. Option D, accumulation of amyloid tissue. Option E, glycation of smooth muscle.
60 seconds. Start now.
C, sir.
Oh, Gilchrist. C again. Charlie.
Yes, sir.
You want me to lock C, Charlie?
Yes, sir.
He's taken this one on the full toss, but let's see where he puts it. Either it's in the stands or it's in the bowler's hand. So I'm going to lock C, Charlie. All right? Lock C, Charlie. And it's definitely over everyone's head and the boundary. What a beautiful stroke. Very well played. Great answer. And it's a 6. So with this, it's wonderfully played in the end. And it was a flurry of 5 6s throughout after having missed 3 in a row. And we have a wonderful game in the end. They come up with a score of 42. But we know that the winners for today's match, it is AMC Troopers, Ayub Medical College. Well done to you. And they only missed one question. And they put up a score of 54, which was fantastic. Fabulous play by them. And 42 was the answer by CMC Lions. I think they also did very well. And it's always, it's not about winning and losing. It's about competing. That's what the spirit is all about. It's about giving your best, delivering your best. And, this is what takes you higher in the end. This is what helps you in your everyday clinical skills, when you assess your patients and your development as medical professionals. Doctors, wonderful performance. I think this was brilliantly done. So congratulations to you, but I think congratulations to both the teams. Very well done. And we do have our worthy umpire, Professor 𝐵𝐸𝐬𝐻 Sahab. He's there. Sir, your thoughts?
Yeah, very good match. I think they played very well, but they didn't have enough luck, I believe. But I like to ask both the teams now, and what is their opinion about the question's validity and fairness? Were the question correct, not ambiguous, especially the question they dropped? I think both the teams, they have this choice to ask me any question. I'd like to explain if there is any ambiguity.
Very right. Teams, go ahead. We want your feedback.
सर ओवरऑल एक्सपीरियंस हमारा अच्छा रहा, लेकिन हमें जो लगता है, जो हम वैसे हारने वाले नहीं थे, हमें टॉस नहीं हराया है।
What did it say?
सर हम हारने वाले वैसे नहीं थे, हमें टॉस नहीं हराया है।
कैसे मुश्किल आ गया आपको?
टॉस सर, जो उन्होंने टॉस जीता ना, क्योंकि उनके बारी के क्वेश्चन सारे इजी थे, हमारे डिफिकल्ट थे।
This is your luck. That's why I said you didn't have enough luck.
लक नहीं था सर, बस यही बात है।
But we can't really, there is no way. I try my best. But there, in fact, this time I received 2 questions, and one question was clearly much more difficult than the other one. I rejected that and asked the author to make another one to make them of the same difficulty level. But it is never possible actually to make them exactly, because there's no way. So I think this is here where the luck counts.
Yes.
Okay, troopers, can we have your input, please?
First of all, thank you so much for providing us such a nice platform to compete. It was a nice experience, and we learned from this experience, and we will do good in Allah ahead.
What was the confusion with the question you dropped?
Sir, we thought it was not sudden onset in renal artery stenosis.
Okay.
So, I think it's nicely explained by Professor 𝐵𝐸𝐬𝐻 Sahab, and it's always about how you read the question. Obviously, you have to decipher the correct answer, but then going back to that initial query, I would say, or a comment that they made, I think it's very right. When the Lions, they mentioned that toss was actually the key, and I think in most of the matches the toss becomes very important, and that's why we've got 2 questions on board. So the first one is whether you want to take it or you want to throw the questions. Again, element of luck there. And then the next part is which 𝐏𝐚𝐤𝐢𝐬 or which case scenario you want to choose. So we have actually kept it onto you so that your luck decides your fate, because it's very difficult for us and or for that matter anyone. So ये आपकी किस्मत है कि वो किस तरफ जाता है. Similarly, जब आप मैच खेलने जाते हैं,
I don't think the team who wins the toss has got any advantage. They have to randomly choose a case scenario. They don't know what case scenarios are.
Yes, actually, sir, बात वही है कि it's the case scenario which comes your way and how you decide. Because cricket match में भी जब आप जाते हैं तो आपको पिच नज़र आ रही है कि बारिश हुई हुई है, it's a green pitch, और आपको वो खिला देते हैं. So that's your luck. It's unfortunate, but this is what it is. So I think this is exactly what it teaches us in life. At times we do not have the best conditions at that point in time for us, but then again, you still have things in your hands. So आप कुछ कहना चाहेंगे सर इसके ऊपर मज़ीद, अजीज साहब?
नहीं, I think it was very interesting match. I feel slightly sorry for the second team. They were good, but sorry, they just couldn't answer a few questions.
Very right. I think your assessment, like always, is pretty spot on. This is the feeling we were getting. And you know what? I was hoping, and I had this feeling probably you guys would end up scoring 9 correct answers, maybe 10, and this is going to get into that territory. And I was hoping for that, because we wanted it like this. But then when we had a flurry of 3 wrong answers, it was still far away from that. But then again, coming to the end, I don't think we do have any of the faculty members available at the moment. Do we have anyone from the panel? Do we have Professor Hakim Abro Sahab? Is he there, your mentor?
No, sir, no one.
No, okay. So again, I think I would like to congratulate him for the performance that you've come up with. And you see, it's not only the question, it's the way you conduct yourself, it's the way you answer the questions, you discuss amongst yourselves, and we always get an impression which team knows how to go about it, which team has prepared, and who are actually worthy to move ahead. So I think both the teams were they were wonderful match for each other. They were wonderful competitors, and they both deserved to move ahead. And I think, inshallah, here and in your lives, and your lives ahead, respective lives ahead, you will do wonders and move ahead with a lot of force. And for that, best of luck to all of you for giving us such a wonderful 1.5 hour of this entertaining and learning experience. So I think this is what this league is all about, Cardiometabolic Premier League at its best. So thank you very much and congratulations to all of you. And with this, we now come to the end, and I will take my leave, and I hope to see you next time with another match, probably the last match of the league, and then we'll have the next stage. So it's going to be extremely important from here on for each and every one of you. Until then, till we meet again, it's Allah Hafiz from my side.